Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodson, and today we'll be talking about some of the exceptional specialty levels of cancer care available close to home in Covington. We'll have two guests. First, we'll talk with Kelly Crim, who is a nurse practitioner in the Breast Health and High Risk Clinic adjacent to the St. Tammany Health System Women's Pavilion. She is an expert in breast health and an understanding of hereditary cancers. Next, we'll talk with Dr. Richard Casey, who is a pulmonologist. Dr. Casey and his partners take care of the intensive care unit in St. Tammany Health System, and Dr. Casey will be talking with us today about a game changer in lung cancer awareness, and that is called EBUS, endobronchial ultrasound. So first we'll start with Kelly Crim. Kelly, welcome to our show.
Thank you. I'm excited to be here.
Well, we're excited to have you. You know, so much is happening in cancer care in Covington. We and our partner Ochsner Health have a whole new cancer center underway that will open in June, and we're excited because that will take the full spectrum of outpatient cancer care that's kind of outgrown its space where it is at 1203 South Tyler, and go down the street. We'll have all modalities. And you know, one of the things that I think is really interesting is we are adding integrative oncology, which means we're taking a holistic approach.
Yes, love that. So
not just the medical modalities, but also alternative therapies and support along the lines of yoga and meditation and support services like financial counseling and social work. So we're really excited about what will be available in the new cancer center.
Yeah, no, that sounds great. I think especially the supportive services, nobody asks for cancer. So if they end up having to live with it and deal with it, it's nice that all of those options are in one place.
Exactly. And all of those options in one place and on one system.
Yes.
And so the patient can see everything in my chart. Every caregiver can see everything in the Epic electronic record. It's just a seamless experience for that patient, their family, and for the care team.
Yes, peace
So
of mind.
Exciting things coming in the summer.
Yes, yes.
So speaking of exciting things, you are part of a whole new clinic that we have opened at the Women's Pavilion. So tell me about the clinic.
Yes, so I am at the new Breast Disease and High Risk Clinic right next to the Women's Pavilion, which is where women come for their mammograms, their breast ultrasounds. They even do bone densities there. So this clinic was created to partner with that in the sense that we are dealing with breast health. High risk breast in the sense that we see women newly diagnosed with breast cancer. We see women living with breast cancer, whether they're still undergoing treatment or if they're 5, 10, 15 years into survival. We also are starting to see women at high risk for breast cancer. There are a couple factors involved with that. So it's exciting.
Yeah, and I wanted to talk a little bit about those factors. So maybe, I guess let's start before we even know we have hereditary issues. We should probably start with women should have some breast health awareness.
Yes.
And be proactive about some of their care.
Yes.
Can you talk a little bit about that to start?
So we push, it's called self-breast awareness now. It's funny that we used to really push for breast self-exams, and we've kind of deviated towards just awareness. When I talk to my patients, I tell them, look in the mirror, look at yourself. It's not just about feeling, it's about looking. I usually tell them before you get in the shower, just look at yourself, you know, maybe kind of put your hands on your hips and look. When you're cleaning, that's a great time to feel around. You know your body. Don't go looking for something to be wrong if it's not there. But know your body, be familiar with it. There are different times, depending on where you are in life, that's preferred. If you are in menopause, you can kind of do it whenever. Doing it, say your birthday is December 12th, you can do it on the 12th of every month to kind of keep on track. If you are still having babies or in the younger phase of life, doing it after your period is probably the best time. Just things are kind of settling back to normal, so to speak, by then.
Right, because you have an arc of hormones happening throughout the month.
Yes, the beauty of
we can get ourselves really concerned about something that isn't a concern if we're checking at the wrong time.
Yes, I worked with someone who once said breasts are always lumpy and bumpy. So as long as you know your lumps and you know your bumps,
There you go. Know yourself.
Yes.
But then once a year, we should also be talking with a professional and having a mammogram.
Yes, and a lot of times your OBGYN will do that. Primary cares will also do that, your family doctor, your internal medicine doctor.
And in Louisiana, just last year, legislation was passed to allow women to seek a mammogram once a year with no physician referral, which is so important.
Yes, and we do get a lot of those at Women's Pavilion. So it's a really nice option that you're not waiting on somebody else to check a box for you to be able to take care of yourself.
Right.
It's exciting. So yes, we do love, you're supposed to start having mammograms. I would prefer every year, starting at 40. But if you've got any history of breast cancer, if your mom had it, if your sister had it, if your aunt had it, you should start having mammograms 10 years prior to their diagnosis.
Wow.
So if your mom was diagnosed with breast cancer at 42, you should start your mammograms at 32. And insurance companies know this. You don't usually have to fight for it. It's kind of a well-approved option at this point.
Really fascinating that it's sort of driven by individual experience, which I suppose is why someone like you who specializes in this is so helpful to us.
Yes.
And what a treasure to this community that we have this level of specialty available for women's breast health. So let's talk a little bit about that hereditary elevated risk.
So only 5 to 10% of all cancers are hereditary. So that includes breast. Only 5 to 10% of all breast cancers are hereditary. Hereditary cancers mean that you were born with a genetic mutation that can cause cancer. So think of yourself as a book, and you are made up of hundreds of thousands of sentences. If you have a genetic mutation, think of it as a typo in one of your sentences that you were born with. So if you were born with it, it means you got it from someone, whether you got it from your mom or your dad. It doesn't mean you are going to get cancer, but look at breast cancer, for example. The average woman has a 12% risk of getting breast cancer. If you have a genetic mutation, your risk of getting breast cancer can be up to like 87%. But you don't know you have it until you know.
Wow. Okay. So if we know we have breast cancer in our family line, say my mom or my aunt or my grandmother, then I should probably be having that conversation with my primary care or my OBGYN to see if I need to be followed early, even though I feel healthy and my mammograms look good.
Yes, and what's interesting about that is there's a difference between familial cancers and hereditary cancers. You can get cancers that run in the family. Those are like 20% of cancers. They're not necessarily from genetic mutations, but they still, for whatever reason, whether it's lifestyle, the environment you grew up in, the food you eat, maybe it's a genetic mutation that happens later in life. It's not something you were born with. Those can run in the family. But then the hereditary aspect, yes, if you start to look back at your own family and think, oh my gosh, there is, all these different cancers, what can that mean for me? If any of those family members are alive and well, they can get genetic tested. They would be great candidates, even if they're 30 years into survival. If that family member is uninterested and you can't convince them, you, under certain circumstances, would be a candidate for testing as well. Knowledge is power.
Exactly. So to me, that's one of the fascinating things about genetic testing related to the fight against cancer. Can you talk a little bit about how people go about looking into that and how your clinic is involved?
Yeah, so for breast cancer specifically, the group of cancers that I look at are breast, ovarian, prostate, and pancreatic. Those are the cancers that are kind of lumped together, so to speak, when it comes to breast cancer. So if you've got anyone in your family, think your children, your parents, your grandparents, your aunts, your uncles, your cousins, if any of them have any of those cancers, depending on what guideline you look at, if you have just one family member with one of those cancers, you are a candidate for testing. You can kind of break it down a little more specific depending on the specific type of cancer. Was it triple negative cancer? Was it inflammatory? The age that they were diagnosed? But for the most part, if you have a family member with one of those cancers, you are a candidate for genetic testing.
So if someone was interested and they pursued genetic testing, can you walk me through how that would go?
Yeah, so what we do mostly is a blood sample. So you have a blood drawn just like you would at your doctor's office, and we send it off to a lab. Typically we don't have a problem with insurance covering it. I know that's kind of a new thing. People don't want to pay thousands of dollars for genetic testing when they don't really know what to do with those results.
Right, but I think health plans have begun to realize that this is useful to them.
Yes.
And so they do cover it in many cases.
So it's gotten a lot better. There are a lot of different companies that do it. We primarily do a blood sample. It takes, once it arrives at the lab, it takes 2 to 4 weeks for the results to come back. And depending on what the results are, I will either call patients with them. If it's a result that warrants a little more in-depth conversation or possibly planning for your medical future, that will be an in-person appointment. But it's just a blood draw. Some places do saliva samples, which is a spit sample. Some places do little cheek swabs. We've just had better, more consistent results with the blood sample.
Right, your most accurate information is going to be in the blood
And usually it's just one time. You don't have to come back for a second draw.
That's pretty fascinating. Well, okay, we've been sort of focused a little bit on the hereditary and genetic aspect, but here in Southeast Louisiana, there are probably just some lifestyle factors. Someone may have family members who've had all types of cancer, but they might be driven from lifestyle choice.
Yes.
Can you talk a little bit about that?
Yeah, so there are a lot of risk factors you can't control. As far as breast and even ovarian, you're a woman, you have breasts and ovaries, you can't control that. You can't control what age you got pregnant, you can't control when you started having periods or when you went through menopause. The things we can change though, if you are young and have a family history, if you are a woman and end up having children, breastfeeding is one of the things you can do to help lower your risk of breast cancer. Related to the area, weight is always going to be a factor, especially weight gain later in life. Weight gain later in life increases your risk for breast cancer. So if you can either prevent that from happening or maintain a healthy weight. Exercise is always going to be good. We'd like you to exercise 30 minutes 5 times a day. In a perfect world, that would be great. I know we're not in a perfect world, but do what you can. And then foods. There are certain foods you can eat that reduce your risk. Foods high in vitamin A, D, and E. So think orange vegetables, sweet potatoes, carrots, orange juice, leafy greens, dairy. A lot of dairy is good. So foods like that, you can incorporate more of them into your diet, into your healthy living, healthy weight maintaining diet. And they will help lower your risk.
Okay, so we can do some things ourselves at home.
Yes.
With our doctor once a year.
Yes.
And then if we have some family history, we may want to look into whether we should talk with someone like you in the hereditary clinic. But then we also could just be taking care of ourselves, eating right, exercising, and we should all do that anyway.
I know, and it seems like such a cop-out. Just, I mean, everyone's going to tell you don't gain weight, don't smoke. But as far as breast cancer is related, weight gain especially is probably the #1 easiest thing you can do to help decrease your risk.
So if we can control our weight, eat some healthy, you said orange and green were the colors we need to be looking for.
Orange vegetables and green vegetables.
Interesting, I like that. Orange and green and some dairy, and then get some exercise.
Yes.
And probably don't smoke. I think
yes, don't ever smoke.
I was interested to learn recently that, you know, we're always focused on breast cancer for women and prostate cancer for men because those are the two highest prevalence. Those are the two that you're absolutely most common for a man or for a woman.
Right.
But the single biggest cancer killer of all of us is lung cancer.
Yes.
And so actually we're reducing our risk of all the cancers, breast cancer and everything that we could face in the cancer realm if we'll quit smoking.
Yes, yes. And I can preach to you all day, every day about not smoking, a healthy weight. It's easy to tell people, I know it's hard to live it, but do the best you can. The most we can hope from you is to try.
Well, that sounds good. So we've got some good advice there. We'll don't smoke or quit smoking, right?
Yes.
And probably vaping as well. I imagine
Yes.
that's just as dangerous
Yes.
or heaven knows more dangerous.
It's still nicotine.
It's it's still polluting your system, right? And then eat healthy, exercise, and do those preventative maintenance
Yes.
opportunities by ourselves and with the doctor.
Yes, know your body.
Outstanding. Well, Kelly, I appreciate you coming in today and talking with us about the clinic. I'm really excited to have this highly specialized
Yes.
breast health clinic available in Covington, Louisiana. It's a
Yes.
wonderful advance in our cancer program.
Yes, it is a good thing we've got going. We've got a great multidisciplinary team. Everybody works together. Everybody communicates really well. It's a good thing.
You know what? I am so glad you brought up multidisciplinary teams because I think we throw that term around and we think about how important it is, but we really don't spend a lot of time helping people understand what is so amazing about all the disciplines focused at once. Can you just describe the multidisciplinary team?
Yeah, so if you don't have breast cancer, when you have a mammogram, a radiologist reads it. Say she sees something that needs to be sampled, she does the biopsy, I talk about results with you, the radiologist will talk about the results with you. Sometimes that report gets sent to your OBGYN or your primary care doctor who will discuss the results. So you've already got multiple people working together there. If you were to be diagnosed with breast cancer, in addition to me, the radiologist, and your primary care doctor, then we're involving a medical oncologist. We're also involving a surgeon. And then depending on what your situation is, if you end up with a mastectomy and desire reconstruction, then there's a plastic surgeon involved. We could talk about genetics and a more specialized area, I suppose, if it was kind of a more involved, kind of atypical, rare condition. But that's, I think I named just like 6 different specialties that are all working together with one patient. So if we all have good communication, we're all talking to each other, everybody's in the same page, the patient is the center of it, and getting all the information they can.
And that to me is what's just amazing about the multidisciplinary team approach. Each of those professionals might be taking care of that patient and not talking to each other in plenty of systems. But at St. Tammany Health System and with our partner Ochsner, we are focused on that multidisciplinary approach to make sure that everyone is in the same system, everybody's focused on the same patient, everybody's looking at each other's data about that patient.
And that I think is the biggest thing, that you're not spending days or weeks waiting on information from another person. It's all right there. You can click on a button and find it. The patients can even do that. They can click on buttons and look at their own information. So it is nice and instant.
And that team actually physically sits together and studies that case together, pulls it up and talks through it.
Twice a month, all of the people involved with breast cancer get together and talk. Pathology's involved at that point as well, and they're not usually people that the patients actually see, but ultimately they're the person that diagnosed you with whatever it is. So yes, everybody gets together and talks about cases. They can ask each other questions. It's a great learning experience. You're always learning.
Well, Kelly, thank you so much for coming in.
Thank you.
I'm excited to have our new clinic and you as a part of the multidisciplinary team for breast cancer. Thanks so much.
Thank you. Thank you so much.
We've been talking with Kelly Crim about high-risk breast cancer and the new clinic adjacent to the Women's Pavilion of St. Tammany Health System.